Dialogue, a series we've been running at the Glenn College for several years, but we're happy to announce that we are now doing this in partnership with WOSU. Some of you may have come to our last dialogue last month on social entrepreneurship, when we did for the first time in partnership with WOSU, and in the future we'll be doing more of those. So look forward to another one in May. We're going to do on women running for public office and the challenges that women face and the opportunities in this current election cycle. But tonight we have a very exciting topic. This is another partnership that we're doing with the College of Public Health. And before I turn it over to my good friend and colleague, Dean Bill Martin, I just want to give sort of some scene setting in terms of dialogue. Not the topic, Bill will cover that, but dialogue is a series that, as the name suggests, invites conversation. So we're going to be looking forward to having all of you participate in this conversation with us. So Bill and our guest are going to start with a small conversation here on the stage, but then at about the 20-minute mark or so, he's going to be looking around the audience for all of you to raise your hands and ask questions. And we will have mic runners on the side, and they will ferry a mic to you, and then by all means ask a penetrating and deep question. Just make it friendly. Dialogue is a series about having a conversation, not an argument. One of the things that we're trying to accomplish here is to bring timely, topical issues before you, full of information and analysis, and sometimes those topics, and tonight is one of those, where they're contentious. And my guess is there are a variety of views in the audience. Our job up here is to make sure that we conduct that conversation in a civil and respectful way. So we, by all means, dialogue does not mean d'accord, the French for agreement. It also doesn't mean anger. It means that we can disagree, but we can do it in a way that we can learn from each other, learn the different perspectives that exist here in the room. The other thing I should say, because we've already heard from people in the ether, in the internet, that we can't represent every perspective up here on stage. We are going to present to you a particular perspective on our topic tonight, and it's one we think it does not get a lot of coverage, and that's why we wanted to bring this before you. But there's no way that in the course of an hour we can have this whole stage filled with all of the different perspectives that are out there. And so again, that's a charge to you. If you want to bring forward an issue that you think is relevant and germane, by all means do that. If you don't see it represented up here, we want you to bring it forward. We've empowered Bill, perhaps at our peril, to be our moderator this evening. And he's going to make sure that we do behave civilly. So if a conversation starts to get hot, he's empowered to lower the temperature. So know that that's part of our evening. And the last thing I'll say is there's all of you in the audience, but there's also everyone out there in TV land, in the interwebs. We're running this on Facebook Live. Hello, wave to the camera. And we have a member of the Glenn College, Deidre Woodward, who's over there waving her hand, is managing the flow of internet traffic or email traffic through that. And so she may be asking questions as well. They will not be hers, they will be those from the audience. So with that, I'm looking forward to a lively and informative and educational discussion on a timely and potentially controversial topic. And with that, I'm going to turn it over to my friend and colleague, Bill Martin, the Dean of the College of Public Health.
Well, thank you, Trevor, and I'm very pleased that tonight I'm joined by Dr. Cassandra Crafasi from Johns Hopkins University Bloomberg School of Public Health. Dr. Crafasi is assistant professor in the Department of Health Policy and Management and a core faculty member in the Center for Gun Policy and Research. She also serves as a deputy director of the Johns Hopkins Baltimore Collaborative for Violence Reduction. Dr. Crafasi's research focuses on injury epidemiology, attitudes and behavior of gun owners, and gun violence prevention and policy. Professor Crafasi is one of the few gun policy researchers in the United States who not only owns guns, but also shoots for sport. Dr. Crafasi believes the Second Amendment protects citizens' rights to have firearms in their homes. regulated by effective, evidence-based gun safety policy. Research into the causes of gun violence is critical to developing policies aimed at reducing this form of violence and making our communities and our schools safer. The College of Public Health and the John Glenn College of Public Affairs are committed to working with community members and policymakers to better understand the causes of gun violence and to better address a public safety issue that results in the deaths of more than 38,000 Americans every year. And tonight's dialogue is an important step in that conversation. So, Dr. Krafasi, it was my pleasure to bring you in from the airport, and joked I was a former taxi driver in an earlier career, and so I was pleased to have that opportunity. Can you tell us a bit about your background, when and how you were introduced to guns, and how this influenced your choice to study gun policy?
Sure. Thank you, and welcome, everyone. Thank you for joining us this evening. My father was in the military, and so there were guns in the home when I was growing up. I did hunting when I grew up in Washington State, and had sort of always been exposed to firearms and had understood from an early age that they were tools, they were not toys, they served a purpose. And so that really sort of supported and influenced how I think about guns now as an adult. I was sort of hesitant to get into gun policy research, to be honest. Listening to the media, growing up, it seemed like there were always people arguing over the topic, and no one seemed to be able to have a reasonable conversation and think about areas upon which we all agree. And as I was working on my PhD, doing my dissertation, looking at assaults against law enforcement officers, I realized that my interest in public safety sort of necessitated doing some work in gun policy. And that was when I really realized that, being a gun owner, I bring a different perspective. As Dean Martin pointed out, there aren't very many gun policy researchers who own firearms. There actually aren't very many gun policy researchers, period, in the United States. But there aren't very many that own guns either. And so bringing the perspective that I appreciate the Second Amendment right to own firearms, but I can also talk about the research and the effectiveness of, holding gun sellers and purchasers more accountable, those sorts of things. So sort of how I ended up where I am now.
Terrific. Thank you so much. Well, tonight we're putting a public health perspective on this issue. And along those lines, I guess we'd like to know, what are the effective and evidence-based policies that exist today that address gun violence? And to that end, I just want to have a little prop. Trevor, can I use props? So we actually, in the front page of the Dispatch today, they covered this evening and the dialogue. But the op-ed, which I found quite interesting, was written by Nick Lashutka, who I believe is the son of a former mayor of Columbus. And he's currently the president and CEO of Ohio Children's Hospital Association. And in the op-ed, he was describing a safe gun storage system, really, for pediatricians to use. And it is called Store It Safe. So I think that is probably one of the least controversial public policies that we should talk about. And so if you can just use perhaps that as one example, but tell us what we should be doing to make gun safety for the home, for the schools, for the community.
Sure. Yeah, we're not easing into this. I see. We're gonna jump right in. So starting with the safe storage example, we know that states that have laws that require gun owners to ensure that youth don't obtain unauthorized access to firearms in the home have lower rates of youth suicide. So youth suicide by firearm is a leading cause of death for young people, and having access to firearms increases that risk because suicide by firearm is extraordinarily lethal compared to other mechanisms that may be used. We know from some of our work that only 55% of gun-owning homes with children store all of their guns safely, so there's still some opportunity to pass these laws in states. Only 27 states and the District of Columbia currently have these child access prevention laws. And so there's some opportunity there, but it's also an opportunity to talk about responsibility. So there's a responsibility of being a gun owner to ensure that people don't obtain unauthorized access to your firearms, and child access prevention laws are really just a reflection of what, in my opinion, is the behavior of responsible gun owners. So that's one area of policy that sort of brings together the responsibility and responsible behaviors with policy that we know is really effective. Probably the number one policy that we have evaluated and others have evaluated that has been shown consistently, regardless of the outcome, the study sample, whether you're looking at states or counties, in terms of effectiveness at reducing gun violence, is requiring prospective handgun purchasers to obtain a permit. We call these laws permit to purchase laws because you have to get a permit to purchase a handgun. And these allow for a longer time to do a background check. So one of the major challenges with the current federal system, if you go to a federally licensed firearm dealer and undergo a national instant check through the system, if that background check does not come back within 3 days, the default is that the seller can proceed with the sale. And so there are times where it takes more than 3 days to identify someone as a prohibited purchaser, and then ATF and the FBI have to go and get those guns back from the person. Now there are companies that have decided they won't allow those kinds of sales to go forward, which is a great business practice. And there are some states that have decided 3 days aren't enough. And so we're going to give local law enforcement 30 days or more to do these background checks. And we've seen reductions in diversions of guns to criminals. So there's that accountability when I get fingerprinted and applied to local law enforcement, and there's a little bit more of a process to get that gun that sort of holds me as a purchaser a little bit more accountable. Sellers only sell to someone with a permit, so you can ensure that at least at some point the seller or the purchaser had undergone a background check. So there's sort of this diversion that can be reduced, but it's also effective at reducing firearm homicide and firearm suicide. A little bit easier to screen out some prohibited people, and that built-in waiting period, the time it takes to get the permit, can delay impulsive acquisition, that a firearm that could be used to harm a person themselves or other people.
Okay, terrific. I guess building on that permit to purchase, could you tell us a little bit about your research with the 2013 Maryland Firearms Safety Act, and what happens with such laws, like in Missouri, when those laws are repealed?
Yeah, absolutely. So there are currently 11 states that have these permit to purchase laws. In 2007, Missouri repealed its law and made it a little bit easier for people to acquire firearms. And as a result of that change, there's a 25% increase in firearm homicide and about a 15% increase in firearm suicide following that law change. Connecticut, until Maryland passed the law, had been the most recent to pass in 1995. And upon passage of their law, in the first 10 years, we saw a 40% decline in firearm homicide and a 16% decline in firearm suicide. Most recently, Maryland passed a permit to purchase law as part of the Firearm Safety Act, and we saw a 76% reduction in diversions of guns to criminals. So how we classify that is a gun that's purchased and then recovered in a crime within 1 year of retail sale. So on average, it takes a gun about 10 years from its original sale to make it into crime. And in Maryland, it's actually 12 years because of some of the policies that reduce diversions of guns to criminals. So if a gun shows up within a year, that says to the FBI and the ATF that this was probably purchased to be used in a crime. And that's particularly true when the person who purchased the gun is not the person who then used it in the crime. So we saw a 76% reduction in the recovery of these guns in Maryland following the passage of the law, and about a 30% increase in guns coming in from other states. So the local source of guns within Baltimore, within Maryland, became constricted, and so people were having to go across state lines to bring guns in. And also to supplement that work, we talked with people who had experience in the underground gun market in Baltimore, people who were prohibited purchasers, they were on parole or probation, and we asked them about the impact of the law, and several of them specifically cited the fact that now there's a permit, it's much harder to get a gun, they cost more, people are not willing to engage in a straw purchase where they buy a gun on your behalf and give it to you even though they know you're prohibited. So we've, this sort of, all of this evidence together suggests to us that this is probably one of the most effective policies at reducing gun violence in the United States.
Thank you. Switzerland. Switzerland is used as a common comparator country to the United States. It's high income. In contrast to the U.S., it has mandatory military service. People who go back into civilian life are given their military gun without bullets. But 25% of households in Switzerland have guns. But for a country of 8.3 million people, in 2016, with high gun ownership, they had 47 attempted homicides and an overall murder rate near 0. Can we learn lessons from Switzerland? Why do you think Switzerland has high gun ownership but doesn't have the problems of violence that we have across the United States?
So I think one thing that we had talked about earlier is sort of the training and the relationship people have with firearms. So currently in the U.S., if you don't live in a state with a permit to purchase law, there may be little to no training required of you before you obtain a firearm. And so you can buy a gun without ever having fired one, without ever undergoing any kind of training. And this is a trend that is, it's an idea that's a little bit more alarming, as in recent years we're trending towards more people owning guns for self-defense than for hunting. And so you can think about the hunter safety training you have to go through, and the training that is required to get a license to then go out and carry a firearm in the woods and hunt animals. And the same training is not necessarily required to own a gun, and actually we're trending towards that same level of training not even being required to carry a loaded and concealed firearm. So 12 states in the U.S. now don't require any kind of training. They don't require you to obtain a permit to be able to carry a concealed firearm. And the states that do require a permit generally don't require you to demonstrate proficiency with the firearm before you can get your permit. So that, we have more people in Switzerland who have military experience, who have these firearms. They went through some training, a slightly different relationship with firearms. But when you look at non-firearm violence, a big outlier for the U.S. is its firearm violence. That's really what's driving our higher rates of homicide overall. But when you look at non-firearm homicide, when you look at rates of mental health or mental illness or bullying, any sorts of things that could be associated with violence, you don't see higher rates of those things sort of driving the issue in the United States. It really comes down to this access to firearms, and in my opinion, a lack of training for individuals who have these firearms, and perhaps a lack of an appreciation of some of the responsibilities that are required of gun owners.
Okay, thank you. Just a few weeks ago, we had a March for Our Lives in Columbus that was very well attended. I went down and saw that, and it really, I think, first of all, there's pride in the next generation and how articulate high school students can be. What do you see the role of students and movements like this that seem to gain tremendous national attention, empathy, and yet over weeks and tends to fade away? Do you think March for Our Lives and this effort will fade away? Do you think it's the right approach to promote the discussion on gun safety? And I guess ultimately, do you think it'll work?
I'm optimistic that it'll work. I think so. I've been studying gun policy and gun violence for years now, and honestly, after Parkland, the activism by youth and the level of engagement and the sustained level of engagement has felt different to me than in incidents past. And part of that is, I think, the students that were affected by the shooting in Parkland were extraordinarily articulate. They in contrary to some of previous events, they immediately started talking about what happened. They immediately started asking for change. Often, the thoughts are, well, let them have some space. They just experienced this traumatic event. But in this instance, they put themselves forward and said, we want to advocate for this change. And I think, an important point, and I think part of the reason that there's a lot of motivation right now, we're There's a lot of primary elections that are going to be coming up. There's a lot of conversation about policy. These are youth who are trying to activate people their own age to get out and vote. We have a midterm election coming up in November, and I think that's going to, I think some of this movement is going to carry people in and keep them activated for that election. I do think that one of the challenges when promoting sort of evidence-based policies is it's a more challenging point to make. Well, we want background checks for all sales. Okay, that's great. That's not too hard to communicate. But then you start getting into some of these other policy points, and they can become a little bit more challenging, as opposed to, we just need more good guys with guns, or they just want to take your guns away. That's a drumbeat that you often hear. That's a little bit easier to communicate. So I think one of the challenges is going to be maintaining a consistent message, a consistent evidence-based message, so that we can talk about risk-based policy and reducing violence across the country.
Okay, thank you. This will be my last question, so I hope you're thinking about questions. In public health, we see the consequences of stigma in many things we deal with. With the opioid crisis, it could be the stigma of people who have addiction to be viewed as criminals, to be viewed as exhibiting a moral failing. And if it is a barrier to care, it is a major, major problem. And addiction is a chronic relapsing disease of the brain. And reframing that gives an entirely different perspective on the issue. And we have many examples in public health where stigma arises. But as I thought about gun violence, one could argue that proponents of gun control, of which I am I wouldn't use the term gun control, I'd say gun safety, but yes, I think we need different gun policies in this country. But it could result in stigmatizing gun owners and proper use of guns and guns for sport and other activities. On the other hand, as I thought about it, if you are a proponent of free access to guns and you discount the violence associated with guns against humans and children, side of this coin is that it always comes up with these are people with mental illness. So you end up taking people with mental illness and putting them in the middle of this as you just control mental illness and the problem goes away. So that's a stigma. How do we deal with this? I mean, we're both in public health. What's the truth? I mean, you don't want to be stigmatized as a gun owner. You're very articulate in why the Second Amendment should remain, although you haven't quite told us what you mean by firearm, or the right to bear arms. So what is meant by arms, which is always an interesting point. But you don't want to be stigmatized, no one does. And yet, both sides of this equation can use stigma. What are your thoughts about it?
So I think I'll start with the second piece first, the mental health piece. So, there's often the conversation after a mass shooting that, the person must have had a mental illness, and if we could restrict access to guns by people who are mentally ill, then, we would have prevented this or something. The challenge with that is that it doesn't actually match with the evidence. So if you eliminated all violence committed against other people by individuals with a mental illness, you would only eliminate like 4 to 7% of interpersonal violence. People with mental health issues are far more likely to harm themselves with firearms than others, which is why almost 2/3 of all gun deaths are suicide. So of the more than 38,000 firearm deaths that happened in 2016, over 20,000 of them were from suicide. So I think it's important to keep in mind that when we're talking about mental health, yes, there are mental health conditions, and sort of being able to unable to care for yourself or having been involuntarily committed, those are prohibiting conditions, and we should screen those individuals out through background checks. But there are lots of other people who may have a mental health issue or suffer from a mental illness who are no risk of harming other people. So I think keeping the evidence up front in these conversations is really important. Your point about stigmatizing we always talk about numbers. We talk about data, how many of this, how many of that, and we don't spend as much time talking to people. We talk about people and we talk about numbers. And so we've made a concerted effort at our center to actually engage in conversations with gun owners to think about how we can frame these policies in a way that's not alienating. I was talking earlier with some folks about the fact that when you engage someone in a conversation about gun policy, everybody sort of comes in like a little bit amped up and sort of ready to start arguing about something. And if you use language that is alienating, like I am loath to hear the term gun control, I feel like it just sets people off thinking that you just want over 85% of U.S. adults support background checks for all sales. Like let's have that be a point of conversation, right? It's not prohibiting anyone from owning guns unless they're already prohibited. But I think having these conversations with gun owners, with non-gun owners, thinking about the language that we use is really important. And also I always tend to bring it back to the idea of responsibility. What is it that responsible gun owners, what are the behaviors that they should be engaging in? And can we have policy that's reflective of what people are actually doing rather than sort of telling people this is what you must do without having first had some conversation?
Thank you. And under full disclosure, I should admit that I'm also a gun owner. I shot, trapped, and with my father, and was very proud of my 50 straight badge that I got as a teenager, and still have my single-shot Beretta shotgun. But I've not had shotgun shells for 50 years, so it's been a while. So now it's open for questions. And obviously we want to continue this as a dialogue, a respectful conversation. But as you can see, Dr. Kafasi is very skilled and looks at this from a very holistic and public health perspective. So, yes, McCaffrey. Do you have a microphone?
Hi, my name's McCaffrey. I'm a senior in the College of Public Health. So I just wanted to ask, how do you think gun policy is specifically a public health issue? And I'm also curious to know, what was your experience in public health like, and how did you kind of get your way to doing research on gun policy and that kind of stuff?
Yeah, thank you. Great question. So I think one of the nice benefits of bringing a public health approach to gun policy and gun violence prevention is the idea of prevention, that we can keep things from happening in the first place. And looking at the range of outcomes. So we're not focused just on homicide or suicide. We also think about unintentional shootings and also undetermined intent, where maybe you're not sure what's going on, because there are, as I talked about earlier, a range of outcomes that gun policy can impact. And so if you only look at one outcome or one population, you're sort of limiting yourself in your evaluation and your ability to make claims about the evidence related to policy. And actually, I wanted to be a physician when I was younger. I got my bachelor's degree in biology and had applied to medical school, and was very nicely referred to the School of Public Health. That was their nice, I was a med school reject, but they referred me over. And I thought, I'll check out public health. It seems interesting. And within the first couple of weeks, so I wanted to be an orthopedic surgeon. I played a lot of sports, got a lot of injuries, and thought it was really cool that you could fix people after they got hurt. And I learned very quickly in public health that you could keep people from getting hurt in the first place. And I was like, whoa, this is crazy. I didn't know that this was a thing. And so I probably would have come to public health much earlier had I known about sort of the ideas of prevention, and that there are policies and population level benefits that we can get to make an impact that it doesn't always have to be at the individual level. So,
wonderful answer and wonderful recruiter for public health. Another question?
Thank you. My name is Kara. I'm a third-year public health student, and I really appreciate that prevention perspective. Given that, and given what you had spoken about, that 2/3 of death by gun is suicide, how do you think that we can take that preventative approach and work to help individuals who may be at risk?
Yeah, absolutely. Really great question. So I mentioned a couple of policies that can have sort of population level approaches, permits that help you screen out prohibited people, waiting periods where you sort of delay acquisition and can prevent someone from obtaining lethal means in a time of crisis. But there's also, I think, an opportunity to work with physicians and other providers and think about how they can have the self-efficacy to be good messengers about safe storage, or maybe having your firearms kept with a friend or a family member while you're going through a rough patch. Some of our work with gun owners, we know that physicians unfortunately are not seen as very credible messengers about guns and safe storage. They tend to see groups and organizations and individuals with experience with guns as being more credible. And so if there's a way that we can partner with those organizations, active duty military, veterans, and law enforcement, and think about having them be the messengers of some of these, but also really working with physicians and other providers to improve their self-efficacy, because they have such a unique point of contact with people who may be at risk. And if we can use that point to talk about safe storage, whether it's pediatric patients with their parents, or someone who may be going through a rough patch, lost their job, or suffering from depression, I think that having providers who are confident to have those conversations really helps. If you ask the question and you don't know, if the provider asks a question and then doesn't know how to provide some guidance or follow-up, it can create a really awkward encounter. I've experienced that with my own pediatrician, and I would hate to have that happen to other parents. And so we're actively working with providers in our institution and nearby institutions to try to improve their collective efficacy, self-efficacy.
Another question?
My name is Brenna. I'm also a third-year public health student. You mentioned earlier that it can be difficult to have effective messaging on specific evidence-based policy points because it is nuanced. It does take more time to explain when compared to a group that can simply say, oh, they want to take everything away, and to break it down into simplified, exaggerated rhetoric. In your personal and in your professional life, how would you say groups that do that have affected your ability to do this research and then to advocate for proper implementation of good?
We're seeing a trend in the United States away from fact and more towards opinion, right? And you can have really strong facts, really strong evidence, but people will say, well, I think it's this, and so, forget your evidence. And that can be very challenging to engage in conversations, but I think the sort of mantra that we follow in our center and the approach I take to my life in general is that if you lead with the evidence, if you have the facts first, then, eventually, hopefully the research will win the day, right? But it is challenging to fight against fear, and fear is very, very real. People, and the reason it's real and the reason it's so effective is because people have experiences, and you hear it on the news, you hear these terrible events that are happening, and, lobbying organizations have leveraged that fear as a way to increase sales of firearms and to pass policies that sort of maybe expand gun access and gun use. And I think, if we can pair some of our evidence and our research with the stories, who's behind the numbers, what does it mean, what does it look like? I think about, in Philadelphia yesterday, there was a 12-year-old that was stopped on the street by police who was carrying an AR-15 on his back. And that, to me, that's an opportunity to use that story to promote safe storage policies and what we know about safe storage, because sometimes a story gets you in the door, but then the evidence that sort of backs up that story helps you move policy forward and keep the conversation going.
Thank you. It's a great answer. And Bruna, I think also in response, I would, of alternative facts, I always remember the quote of Daniel Patrick Moynihan, who said, "You're entitled to your own opinions. You are not entitled to your own facts." And I think science has to underpin what we're doing. It has to underpin sound public policy. Other questions? right in front.
Hi, my name's Julia Barrett. I just graduated from OSU in French and Fine Arts. Thank you. I'm also a part of March for Our Lives. I'm the artist and event coordinator for the March for Our Lives for Columbus. So I figured I would talk since you brought it up.
You sent me an email, right?
I did.
Yeah, okay.
I did. So I wasn't expecting to be here, but hi. So I guess my question is there anything in your research that has surprised you?
That's a really good question. I think surprise maybe isn't the right word that I would use, but maybe didn't match sort of our hypothesis going in. So people assume that because we are from the Johns Hopkins Bloomberg School of Public Health that, we all hate guns and want to take them away. And, people will often assume that we support any policy that sort of restricts access to firearms. But in fact, we think the evidence should show whether something's effective or not, and if not, we should repeal it. And so, one of the challenges, or maybe one of the things that didn't match with what I expected, was when I was doing my dissertation research. We often hear that permissive concealed carry laws increase violent crime, and we've looked at that. Our colleagues have looked at that a bunch of different ways, and so the best available evidence shows that there's increasing risk of violent crime as you have more people carrying loaded and concealed firearms. And so some of the work I was looking at was, did that hold true for assaults against law enforcement officers? So if you have more people carrying concealed firearms, do you see more police officers being killed? And that didn't hold up. That we found no effect. And we published that. These laws don't have an effect on the safety of police officers, generally because people who carry firearms are overall law-abiding citizens, on average. And so we were testing a hypothesis, and we found negative results, and we published that. But I think that was maybe the thing that didn't fit with the hypothesis, and I guess I would say it was surprising.
Thank you. Hi, I'm Lisa Voigt. I teach in the Department of Spanish and Portuguese here, but I'm also a volunteer with Moms Demand Action for Gun Sense in America. I'm not wearing this t-shirt because of this event, actually. It's because today at the State House there were 2 hearings in both the House and the Senate about some bills that are moving through. One is, actually they're mirrored bills in both the House and the Senate, and they're stand your ground bills, and also include a portion that we call permitless carry, but it would be effectively reduce the penalties for carrying concealed carry without a permit to a minor misdemeanor. So you've spoken about your research that would relate to the concealed carry portion of that bill, but I wondered about your thoughts about stand your ground, and the little bit of research that I did just in preparation for going to the hearing. I did find studies that showed an increase in homicides, an increase in gun violence in the states where it is passed. And I wondered, my impression was, I didn't read through some of this literature, is more for people in your field, and very long studies, and but my impression was, because there was this period of time where lots of stand your ground laws passed, that perhaps it does offer an opportunity to actually measure their impact. And so I just wondered if we could hear a little bit more about stand your ground.
Yeah, so we have looked at stand your ground in state level evaluations, and the evaluations that we do look at change over time. So look to see which states have laws and which states don't, and look for an association, but a far stronger model is to look to see when something changes, looking at the trend before and the trend after, and doing that comparison. And so we've done that with stand your ground laws and found that they do increase risk of firearm homicide at the state level. We're currently working on a county level analysis, looking at because we know firearm homicide tends to concentrate in urban areas. We're looking at the largest urban counties in the U.S. and doing a similar evaluation. of permit to purchase and stand your ground and right to carry laws. And we're seeing, again, harmful effects of stand your ground laws. You know, the idea behind a stand your ground law is it sort of removes a person's duty to retreat. So if we're in an altercation and, you know, it looks like it's sort of going to get more heated, in states without these laws, people have a duty to say, okay, well, I'm gonna get away if I can, but you've removed that duty, and so situations that may not have resulted in a fatality now may, because, you know, people can stand their ground and you know, defend themselves whether or not that sort of defense is warranted. So yeah, we've seen that, and research by some of our colleagues has found similar increased firearm homicide risk in states with stand your ground laws.
Okay, I guess we have a question off Facebook.
As you look ahead at your research or research in general, what don't we know? And what are some of the big questions yet to be answered?
That's a really great question. Thank you. So one of the challenges with gun policy and gun violence research is, you know, there's very few federal funds available, and so some of the basic epidemiological research that gets done on other topics doesn't really get done in gun violence and gun policy, because we're reliant upon foundation funding, and they usually want to see some test of an intervention or evaluation of something, and it's a little bit harder to get some of that work done. So two things that sort of come to mind immediately are, we don't really have a good sense of how firearm laws affect non-fatal shootings. So there are states and police departments, cities that collect this data, but when it gets aggregated up into and reported to the UCR, the Uniform Crime Report for the FBI, it gets lumped in with aggravated assaults with a firearm. And that can be something as, I shoot you and actually wound you, to something as, I don't mean it to be simple, but, you know, something as simple as someone points a firearm at you. Those are counted as the same things. And so we sort of washes out some of the effects. And so we can't say with any certainty whether these policies have an effect on non-fatal shootings, or if the effects are specific to homicide. The other thing is, because of some amendments that went through in 2003, the ATF is prohibited from releasing information on where guns used in crime come from. And so there are some reports that are published online, but you can't get the individual gun level data. So it's impossible to know, are there gun shops within states that are responsible for, you know, maybe they have bad sales practices? Are there individuals who are selling lots of guns in straw purchases, perhaps, that are being recovered in crime? And so we know when the original sale happened, you know, if you're lucky enough to be able to partner with a police department to get some of that data. But you can't look across states, or even sometimes within states. And so we lack an understanding of the sources of crime guns, right? Like, guns don't grow on trees. They originate in a sale, and then you know, they are transitioned somehow and used in crime. So being able to identify those sources is really important. And then being able to quantify the effects of policies on non-fatal shootings, I think, is equally important.
Okay, thank you. All right, yes. Yes, right in front. Oh, but you need a microphone.
No,
Is there?
that one? Yeah.
My name is Carl Tischler. I'm adjunct associate professor of psychology and psychiatry here at Ohio State. My area of specialty is suicide and personal violence. Under the previous administration, by executive order, the president linked Social Security disability for psychiatric reasons to getting a gun. And you were not allowed to under the previous president. The current administration revoked that. And so people who receive psychiatric disability are able to purchase a firearm without any predetermination as to their fitness for purchasing one. Do you think that would be something that people to revert back to linking that disability to not being able to purchase a firearm? And my second question, since I've got the microphone, is you mentioned that in Missouri the suicide by firearms went up 15% when they dumbed down the ability to purchase. Did that change the overall suicide rate, though? You didn't say that.
So I'll start with your second question. So we saw increases in total suicide. So there was no effect of the law change on non-firearm suicide, but we saw increases in total firearm suicide, or total suicide and firearm suicide, and that increase in total suicide was really driven by the firearm suicide. Your first point about changing the reporting of records, I think the challenge there is people who who the government has decided are not capable of managing their finances or are not capable of working. Those individuals, those records being reported was a way to sort of reduce their risk of self-harm through firearms. And I think I disagree with the current president's decision to change that. I think that we're doing a disservice to individuals who may be experiencing a crisis and wanting to obtain firearms. And I think the point about Missouri, when we saw this increase, they removed that sort of built-in waiting period as part of the permit, and so people were able to more impulsively buy these firearms and use them in a time of crisis. So I think the effect of this change in the social security policy may be mitigated somewhat in states that have slightly more robust laws, but in states that really don't have anything beyond the federal law and certainly don't require background checks for private sales, then that's created an opportunity for these individuals to obtain firearms and unfortunately use them potentially to harm themselves.
Okay. And then there was a question down. Thank you.
My name is Lee Peters. I'm a 1992 MPA grad from Ohio State, or I should say the Ohio State University. Do you know if there's any research? I've often thought about this in terms of just a violence issue. So we talk about gun violence, but we're seeing now a rise of other means, whether it's knives or cars, plowing into pedestrians, or even fistfights. Do you know of any medical research? I know it gets a little bit beyond the public health purview, but is there any medical research going on in terms of what causes violent behavior? Just out of curiosity.
Yeah, great question. So people far more intelligent than I am could answer this far more eloquently than I could, but we do know that there are some different trajectories, sort of how individuals develop, right, your prefrontal cortex and where you are in your life, your long-term planning and impulsivity and things of that nature. Unfortunately, I can't give you much better an answer than that, but I'm sure that there's probably somebody in the room who could probably answer that better than I could, but I'd be happy to follow up and connect you with someone who could answer that question if that'd be of interest.
Do we have any questions from Facebook? We don't. Okay. Yeah.
Hi, my name's Brad Bushman. I'm a professor of communication and psychology here at Ohio State, and I know your colleague Daniel Webster. We were on the National Science Foundation Youth Violence Committee following the Newtown shooting, and we were also together on President Obama's Gun Violence Committee. I was wondering if you know of any research. Correct me if I'm wrong, but it seems like 3% of the population owns 50% of the guns in the U.S. Do we know anything, research about this segment of the population, or that's a question I had.
Yeah, no, you're right. Research, and great question. Research by some of our colleagues at Harvard. They did sort of the most recent and robust survey of gun owners to get a sense of who owns guns and what kinds of guns they own. And yeah, you're correct. 3% of the U.S. population owns 50% of the firearms. Sort of who and what they are, my colleagues at Harvard could probably answer that a little bit better. But I will say, one of my concerns, that people will talk about the right of the Second Amendment is, we want to protect against a potential tyrannical government, right? We want to be able to overthrow them if they, start doing things that we deem unfit. But a concern that I have is there are laws that have allowed individuals to amass a number of firearms that increases the risk of private tyranny, and that's alarming to me. So when an individual, a private citizen, has the ability or the capability at a minimum to engage in private tyranny and cause a lot of fear, I find that very alarming. And that's not to say that the 3% of the population are dangerous or intending to harm anyone. Certainly, I don't mean to imply that, but we need to be thinking about balancing this personal tyranny and private tyranny, and in the grand scheme of things, right? Like if the government wanted to cause us lots of harm, they'd just drone strike us anyway, right? Like we're not gonna be able to fight against tanks and nuclear weapons. So I think as weaponry has changed, we need to be thinking about the balance between personal and private tyranny.
Great answer. We have about 9 minutes left. I'd like to ask one question because it may not get asked. So the Second Amendment and the right to keep and bear arms, from a public health perspective, what do you think the best answer is? What is considered in today's world arms? Because we're taking an amendment passed in the 18th century and is now part of our lives. But so there is a spectrum, of course. I guess you go from a musket to a grenade launcher. But how do you see this as a gun owner and as a public health faculty member? What should the Second Amendment term arms mean practically in terms of Congress and how you might advocate for this?
Yeah, good question. Before I jump into that, I do want to just really briefly share. Someone had shared a video with me that was a gentleman walking into an office with a musket, and he fired his musket, and everyone was like, holy cow, and they all ran away, and he had to put the butt of the musket down and load in things, and and by the time he was ready to shoot again, everyone had ran away, right? And the whole point was our guns have changed, maybe our gun laws should change too, and I just found that amusing, and potentially we're sharing with you folks. You can look it up. I'm sure it's on YouTube. So I mean, the way that courts and Congress and have been thinking about the Second Amendment and the definition of arms, it's things that are commonly used, commonly available firearms. So a fully automatic rifle is not commonly used. It's not commonly available, partly because they were highly regulated in the 1980s, and so they're not around the way that perhaps assault style rifles are, like AR-15s. But I think the challenge really is for us to decide as a people how we want to define arms. So I personally don't own any semi-automatic rifles. I only own sort of bolt action. You gotta do something before you can fire the gun again. I do own semi-automatic handguns for sport shooting. I don't want to get too much into sort of my personal opinion on things. We can talk on the side if you really, really want to know what I think. But there's inconclusive evidence on the effectiveness of the assault weapons ban, for example, that passed in '94 and then lapsed, partly because there were so many loopholes for gun manufacturers to sort of get around the definition, and then once the law lapsed, they became now, unfortunately, commonly available weapons, and so I think it's going to be far harder using that standard to think about regulating things like that.
Okay, thank you. In back, I guess, was first. Thanks, and then we'll come. In back. So, straight back, blue jacket. Right.
Oh no, she's in the corner, right there. Yeah, you've got
Oh,
it. Go
great.
for it.
Oh.
Hi.
I got you.
So, thanks and good evening. My name's Teresa Long, and I'm just wondering, and you just made mention, following on what Dr. Martin had to say, so maybe it's a personal opinion or it's how the center thinks about this, but if you had a magic wand, or the ear of our president or of our congressional representatives, what is it that you would recommend that would make common sense? We're all thinking here, I'm a public health physician, thinking about health in all policy, health equity in all policies. what is it that we should really be pushing for that would protect people, protect rights, etc.? And I assume that the center or you have some personal or center thoughts.
Sure. So I think the number one thing that I think is necessary but not sufficient is to have background checks for all sales. So background checks are really the foundation upon which we build all of our other firearm laws. And in the 31 states that don't require background checks for private sales, we're building our house of gun laws in like a marsh, and eventually it's going to sink into the ground, versus like having a nice concrete slab where we have a nice strong foundation. So I think it's necessary, but I don't think background checks alone are going to help us reduce gun violence. I think we need to have a permitting system that increases purchaser and seller accountability. I think we need to have some waiting periods to delay acquisition. I think those are some of the strongest evidence-based policies that we have. Yeah, again, we can talk about some of my personal opinions afterward. Yeah.
Does the center work with advocates for those sorts of policies to try and move those forward, whether it be community level, state level, or obviously national?
Absolutely, yeah. We have a communications director who shares all of our research with local and state and national advocacy groups. We actually just had a meeting with Everytown for Gun Safety a couple of weeks ago, thinking about our research, what we have published, and also you know, what we have in the works, keeping them apprised of what's going on. Faiths United to prevent gun violence, so working with faith-based organizations to promote, you know, reasonable evidence-based policies.
3 minutes. So there, a gentleman in the back had his hand up some time ago, and then we'll.
Thank you. Richard Meyer, retired faculty member. I hope you will remember what I can't remember precisely. I think it was 2 to 3 weeks ago. The Washington Post carried a story on mass shootings. And as I remember the beginning of it, they had to describe in rather considerable detail how they went about collecting the data on those episodes so they could then go on and make some analysis and some conclusions out of that. I wonder if you remember that particular one and if the methodology was particularly robust. Secondly, if one were going to engage in public policy discussions, educational programs, and so on, does your center, is there anywhere sort of a centralized literature source that one can go to get literature which is presumably done by all kinds of think tank groups, universities, and so on, all scattered around, all fragmented, and so on, and one has to go to 100 websites if one finds search on a particular topic?
Yeah, great question. So yeah, I am familiar with that story, the new story about mass shootings. One of the challenges is that's not something that's routinely tracked by the government, and so it's reliant upon sort of crowdsourced information and drawing from news stories. I think we could do a far better job thinking about prevention related to mass shootings if we had you know, a reliable source of this information. And that's not to say that the methodology was poor in any way. I think they did a very robust effort to gather up as many as they could. The challenge is when we think about over time, you know, news stories that have happened in the age of the internet are far more likely to be on the internet, and so it sort of biases the sample towards the more recent studies. With regard to your question about a source of information, I think, you know, I think Everytown for Gun Safety, and I think the Gifford Center, which is smartgunlaws.org, they try very hard to gather up as much information as possible. Another great source of information related to gun violence and gun policy is The Trace. And it's a news organization. They write stories and they sort of follow things up. One of the challenges, you know, people are sort of focused on the things that they're doing, and I think having some resources for a group to gather up that relevant information would probably be very helpful, both for researchers and also for individuals who are just interested.
So I am sorry, we are at the end of our questions, but perhaps Dr. Kafasi can spend a few minutes with you if after the program. The issue of gun violence is complex and deeply rooted in our culture, which is why we must take a public health approach to ensuring families and communities are safe. It is our hope that we will place a renewed emphasis on improving gun injury and violence research. Ongoing work is needed, and tonight was a great opportunity to learn and self-reflect on how we can all have an impact. Thank you so much for joining us. And thank you, Dr. Kapasi.